BCDI is one of 143 federally recognized centers of excellence to help people with bleeding and clotting disorders in the country. 143. And in the state of Illinois, there are 3 up in Chicago, and there's 1 in downstate, and that's us. So as you'll see, and toward the end of my slides, you'll see sort of a scope of what we do. But this is a requirement by the federal government that gives us the grant that allows us to call ourselves a center of excellence, to have this day where we share information, two-way street. You guys enter a discussion, ask questions. Hopefully we all learn something by the end of it. Right. So I'm going to lead off with a short talk about a certain platelet disorder that our center has become known for, called ITP. It's a little bit about ITP and a lot about our model of care that sets us apart from every other center in the country that takes care of people with ITP. So my talk is a little bit about ITP, but a lot about how we do things in general around here. And then Dr. Roberts is going to come up. Dr. Roberts is our Associate Medical Director. He's also the Associate Director of Research here and Associate Director of the lab. So he wears a lot of hats. And also, as some of you probably know, he runs a very active clinic here as well. Dr. Roberts is going to talk about some of the state of the art and really what's in the pipeline for people with other bleeding and clotting disorders other than what I'm going to mention. Beth Hemhold is our registered dietitian. Beth's been working with us for several years and full-time for a few years. And as you've probably met her, if you've come to a comprehensive clinic, Beth adds an element that we've needed for a long time because, as you'll see in our model of care, we don't just take care of your platelet count or your factor level. We want to help you take care of all of you, your whole self, right? And Beth's contribution to that is integral. So Beth's going to talk to you about some very sort of pertinent topics in whole body health, especially in nutrition. And then Becky Burns is our CFO, walking in the room right now, our Chief Financial Officer, Chief Operating Officer. Becky has been working with BCDI for 9 years, about 9 years. And in that short time has become a national expert on healthcare services and insurance utilization. Becky not only keeps herself very busy helping our patients here, but I want to say probably on an almost daily basis, if not daily, gets called from other centers around the country to ask her advice about what to do about this certain insurance dilemmas that she's going to talk to you about today. All right, so with that, about ITP, which you know is an abbreviation for what used to be called immune thrombocytopenic purpura. Now we call it primary immune thrombocytopenia. The I in ITP means your immune system is not doing something right. The long word thrombocytopenia means your platelets in your blood are low. And the P is an old Latin derived word called purpura that means your skin develops little purple spots on it. And those are in common language, that's bruising, but it happens because your platelets are low. We have a definition of it because sometimes it just happens that in that very specific way, your immune system goes awry and attacks your platelets and causes them to be low in your blood. Sometimes it's related to something else that's going on, like another autoimmune disorder, for example. Like some people that come to our clinic have lupus, but they also, which is an autoimmune disease, but they also have low platelets because of their lupus. So we call that secondary ITP. So what is it really? It means your body's excessively destroying your platelets, and it's by your immune system. Your body makes antibodies that attack your platelets. Because the platelets look very much like the cells they come from, those cells they come from also get attacked by your immune system. So in essence, you're not producing the platelets, and the ones that are mature platelets in your bloodstream are getting destroyed prematurely. The net result is your platelet count is low and you have an increased risk of bleeding. So the treatment for it, we say the word paradigm, the sort of the approach or the philosophy behind treatment has changed over the years. It was a long time ago that we realized that this was an immune system problem. So if we thought if we suppressed the immune system with medicine, then we could maybe turn off that bad effect on your platelets. So that was one paradigm of treatment, but because the cells that become platelets are affected as well, we thought if we could drive your body to make more platelets, then the count would go up and sort of like override the effect of your immune system. And the net effect would be your platelets would rise and your bleeding risk would be less. So we have medicines that sort of follow each of those paradigms. And sometimes one of them works. Sometimes it takes more than one of them to work. Sometimes it takes trying one or another before we find the right one that works. But we do have a good choice of very effective therapies, effective treatments for ITP. I like to show this because I like his medical history, and this is an experiment that was thought up by a medical student actually back in the 1950s. And then it was kind of thought, well, this ITP stuff, it must be something to do with the immune system. So that means if people that have ITP have immunity or antibodies, then if we took their plasma out and gave it to people with healthy platelets, that their platelets should drop, right? So the bad stuff in the plasma of people with ITP should make a healthy person drop their platelets. So that's what this experiment was. And it was done by a medical student named Harrington. And actually let's see, does this work? If you look at that graph over there, you see that the line here, I'll just point to it. The line here is what happens to the platelet count over time. So they're okay to begin with. They drop suddenly after they get the plasma from people with ITP. And then over time, the bad stuff in the donated plasma goes away and the platelets go back up. But this line here was Harrington. So he gave it to himself. Like he participated in the research. And he actually had bleeding because of it. He had bleeding in his gastrointestinal tract. So that was our first sort of appreciation for the idea that there's something bad in the blood of people with ITP, and it's coming from their own immune system. Okay, so who gets ITP? It can happen at any age. When you're young, it seems to happen almost equally between boys and girls. So the dark is males and the hollow is females. And as you get older, it seems to be different in the different groups. So like middle-aged women tend to have ITP more than middle-aged men, and elderly men tend to have ITP more than elderly men. In kids, it seems to be almost equal. How do we make the diagnosis? It's very sophisticated. It's either a boo-boo or an owl. You need to do tests to find out which it is. So when we make the diagnosis of ITP, look at the columns. For all patients, we don't do that much, right? Because there's some very telltale things that tell us this is ITP and not something else. Now, sometimes, depending on where people have traveled, what their lifestyle is like, sometimes we do these extra tests to make the diagnosis, but honestly, it's just us looking at your blood count in the laboratory and like Dr. Roberts or I looking at your blood under the microscope. And we can make the diagnosis probably 95% of the time. Now, this is why it's in red. In the era of the pandemic, some people that get COVID will have a really low platelet count because of the COVID, right when they're having the COVID, sometimes after. So we always test for COVID now. If someone comes in newly diagnosed. If things look a little less clear to us, then we do some of these other tests. But for the most part, we make the diagnosis fairly straightforward with a minimum of tests. Okay. So what does ITP do? What does it mean for you if you have it or someone you know has it? Well, we always have to think broadly. Again, that goes to our model of care, right? We're not just paying attention to one blood test or a platelet count, et cetera. So we're looking at the whole picture. So the consequences can be related to the disorder itself, of course, but remember, every medicine we give to you, no matter what, for what, there's always associated side effects that are possible, right? So sometimes the consequences of ITP are related to the medicine we give. And certainly we have to try to avoid that, right? And then the consequences too can be related to lifestyle. I remember still very clearly, it was 30 years ago that I took care of a young man with ITP. And he only came to diagnosis because he was a bull rider in the rodeo. And a bull threw him and he came in the next day full of bruises. So partly that was his ITP causing a problem, but partly it was his lifestyle, like what he did for fun and for a living. Okay, the symptoms of it are symptoms that are very common to most bleeding disorders. Bruising, the little red spots on your skin that are kind of like micro bruises, nosebleeds, gum bleeding, sometimes blood in the urine, sometimes blood in your stool, and very uncommonly, thankfully, but still a very serious issue, you could have bleeding inside your head. So we at all costs want to avoid that. So we've looked at that in studies over the years. This is a study we did a little while back that was published back in 2020 to look at like where, especially in kids that are diagnosed with ITP, how often do they have bleeding? Where is the bleeding and how serious is it? So this chart, if you look at the columns there, in the first month, that's when we think, oh, that's when it's the most risky because that's when the platelet count is lowest and that's when we haven't started treatment yet, right? But we did find that there are a certain number of kids that will have bleeding even beyond that first month and even up to 2 years. So if the ITP continues to happen, because many times it goes away in children on its own, we have to be very vigilant about the risk for bleeding. If you look at older folks that get ITP, we always think, well, is it going to shorten their life? Is it going to change their life? So we've looked at what sort of causes those major problems in adults. We thankfully, the mortality of it or how much it causes death is very, very low, but it does tend to increase as our age gets above 65, which has personal meaning for me very soon. So, and you can just imagine, just in general, our health concerns rise as we get older, right? The years take its toll, I guess. Okay, but here's something important that I alluded to earlier. What are the causes of death when people do die from ITP? Sometimes it is bleeding. Sometimes it's having had their spleens taken out, because in the old days, that was a very common treatment for ITP that we do much less often now. But sometimes it's infection. And if we suppress the immune system, we make up with medicine, we make them more prone to infection, right? So we have to be very careful about monitoring that. We tend to shy away from medicines that cause a suppression of the immune system. Here's a graph from a paper we wrote several years back that just proved to us that the lower the platelet count is with ITP, the more likely you have bleeding. But what was encouraging is that serious bleeding almost never happened if your platelet count was above 50,000, normal being about 150,000 to 400. So very few people have bad bleeding, unless a terrible accident happens or something like that. Very few people have any bad bleeding if their platelet count is above 50. So what do we do with people with ITP? If it were this simple, I'd be really, really happy. Rub it on everything, yeah. But we don't have that. So we tend to talk about treatment as either frontline or second. What we do when we first recognize the ITP, and then what we do if that medicine doesn't do the trick, right? It doesn't last as long as we want it to last. So we have treatments like immune globulin that changes your immune system, but it doesn't suppress your immune system. So it's a very common first medicine to give, especially for kids with ITP. but also sometimes for adults. Steroids, like you've all heard of prednisone. Maybe some of you have heard of dexamethasone, kind of the stronger, more potent cousin of prednisone. But that's a very common treatment as a first-line treatment, especially for adults with ITP. And then the third one is just a variation of the IVIG, and we don't use that much anymore. But when those don't work or those don't sustain the platelet count where we use other medicines that we call second-line treatment. And the first one, these what are called TPO agents, and those three long names are examples of ones that are approved on the market now. Those don't suppress the immune system, they just make your platelets grow more, and the growth of those extra platelets overrides the destruction of the platelets and deals with that impaired production of the platelets, and the net effect, your platelet count goes up. And these work in almost 90% of people with ITP. The others are ones that suppress the immune system, and like I mentioned, we rarely do splenectomies anymore or take a person's spleen out. Okay, so this next little portion for a few minutes, I'm going to talk about some practical stuff. And this is a sort of excerpted from a talk that I and one of our nurse practitioners, you probably know, Kristen Anstead, presented at a national meeting for people with ITP. So we came up based on what our patients were telling us with these important questions. Like, why do some doctors order so many blood tests when they're diagnosing ITP and others don't? What's the safe platelet count? You hear that one very frequently. Can I take aspirin or ibuprofen when I have ITP? Can I play contact sports or ride on the graviton or scuba dive? We commonly get those, especially in the summertime, but with the amusement park stuff. And then the most common question has to do with food and supplements. Are there supplements or food that can make my blood clot better? Are there foods that are bad for my platelets? What should we do about that? And for that last question, I'm always very glad that we have Beth on staff, because Beth can speak to that better than I can. Okay, we have very simple rules, and this transcends ITP. This is for anyone with a bleeding disorder. We typically advise against aspirin. So if someone says, can I take aspirin for a headache or sore joints or whatever, we typically say no, because aspirin will impair the way your platelets work. So if your platelets are low, and in ITP, even though they're low, they work really well, right? So if we all of a sudden on top of that impair how your platelets work, it's going to increase your risk of bleeding. Now, there is a little bit of a caveat or disclaimer there, because there are certain people that even though their platelets are low, if they have secondary ITP, they're at increased risk of having a blood clot. So for some of them, we do prescribe aspirin as part of their therapy. It's an exception to the rule, though. Oh, I didn't mention at the beginning, if you have questions or something to share, please say, just let me know. Yeah.
So would you suggest, like, our son has ITP, like we should give him Tylenol instead of like just in general, just maybe when he's sick and stuff?
No, if he gets over his ITP, like I said, kids usually have a short course with it. It's usually gone by 6 months or a year. If that happens and it resolves on its own, then you can go back to doing what you normally do. Because the rate of it coming back is very high, especially in boys. Yeah, but we usually say while you have it, don't take aspirin. And Dr. Roberts will probably affirm that for a bleeding disorder. What about sport? Oh, was there another question? Yeah.
You go ahead.
Okay. If a child has a fever, what do you give them to get the fever down if you can't do aspirin?
Yeah, so Tylenol or acetaminophen, like generic acetaminophen, is perfect for that.
Thank you.
Now, sometimes depending on what germ is causing the fever, sometimes the Tylenol doesn't work. So we usually say that like conservative stuff, like putting a cold cloth or a tepid bath to help get the fever down, is preferred over giving an aspirin. If that doesn't work, then call us and we'll talk about alternative things to do. Yes.
So you said with secondary ITP, people tend to be more at risk of blood clots. What about that makes one more at risk? Like, what's the difference?
Well, why do they have a risk for blood clots?
Yeah, for secondary one, what makes it higher?
Yeah, because the two don't sound like they go together, right? Low platelets should mean bleeding, but sometimes the platelets are low because your body is sort of utilizing and activating and spending the platelets inappropriately. And the net effect on the platelet count is it lowers. But all of that process I just mentioned does facilitate a blood clot. So like when people have lupus, for example, or antiphospholipid syndrome, APS, we call it for short. That's what happens in those situations. Like the platelet count being low is sort of like an aftermath of the process that's increasing your risk for a clot. Okay, so can you participate in sports? I guess it all comes down to what it is and how the person or child is participating in it. Because, like, for example, if I were to, let's say, downhill ski on the bunny hill, which is where I end up if I ever go skiing, it may be one level of risk, but if someone's an elite skier and they're on the double black diamond hills and going 80 miles an hour down a hill, it's a whole different ballgame for risk, right? So our colleagues, Dr. Kumar and company, sort of did a survey of all physicians to try to get everyone on the same page with understanding what is risk when it comes to activities, right? And as you can see, if all of the bars were all uniformly the same color, that meant everyone agreed, right? So all of those activities, especially in the middle, like taekwondo, for example, some physicians thought that taekwondo was low risk. So, and you can maybe understand that. I mean, you could participate in taekwondo and not make any contact with another person, right? And maybe that part's low risk. But if you're doing full contact, sparring and throwing each other around, that could be considerably more risk. Basketball, basketball can get pretty rough, especially now that the WNBA is way more popular over these last several months with some of the new recruits. I've watched a few games and they're pretty tough and people get hurt, right? So it all depends on how you play. If you're shooting baskets by yourself in the backyard, maybe low risk. If you're full out on the playground even, people can get hurt. So we have to understand what kind of risk is involved. We do say, and I think there's pretty good agreement, that things like swimming, as long as you're not banging your head on the side of the pool, or walking, as long as you don't accidentally step in a sinkhole, are pretty low risk. Let's see. I'll just skip over that one. Okay, Beth can certainly answer way more questions about this. It's not exactly the topic of her talk, but Beth's here, so afterwards, if you have questions about foods and your platelets or foods and bleeding or clotting, we both can help field those. I put these pictures on here because these are 3 of the only examples of foods that mess with your platelet function, right? So unfortunately, garlic, which so many people love, excessive amounts can make your platelets very slippery and not work well. So we usually tell people with ITP, limit the garlic in your food. On the right-hand side, blueberries are listed as a food that can affect your platelet function. But the studies have shown that unless you consume a truckload of blueberries, it's not really going to have an appreciable amount of effect on your platelets. And then avocados are in the same category. So avocados really don't cause, yeah, right. It's all the good stuff, right? Yeah, you would have to consume a ton of avocado to have any kind of effect. So, now, this is up there just as a caution to you, because sometimes, and you know this as well or better than I do, sometimes titles we read to articles grab your attention so that so that you click on the story, right? And the story really doesn't have much substance to it. The title makes you think, oh, how to naturally increase your platelet count. If I had ITP, I'd want to read that story, right? But there's no substance in there because no food will naturally increase your platelet count, unfortunately. So be careful about these kind of articles that are almost in that category of clickbait. You know?
There's probably some foods that help your immune system, right? Like if you're eating healthier, it's gonna boost your immune system versus eating a bunch of crap.
Yeah, good point. So there's no, I know all about eating crappy food. And not the doctor. Yeah, that's sort of like a once removed idea, right? If the problem is with your immune system and you sort of eat foods to calm your immune system, could it help your ITP? People have looked at that from a just experience, like an anecdotal, this is what happened to me kind of approach, or this is what happened to a group of us that agree on that. But when it's been put to like a scientific rigor and scientific study, nothing has ever shown to help that. I think naturally, if you're allergic to a certain food, like stay away from that food, just for general purposes. Could it have an effect on your ITP? Possibly, but when we've looked at it formally, it's not really panned out. I would still have the same advice though. Stay away from food that irritates you, that maybe gives you a rash, that maybe makes your tongue itchy, like all those little subtle signs that you're having an allergic reaction. Okay. The roller coaster issue, I have very conservative advice about that because over the years, there's been like this, we don't hear about it, this competition to make the fastest roller coaster possible. And some of them go in excess of 140, 150 miles an hour now. Okay, so you got to think, is that speed, especially when it's going up or down, like vertically, is that going to change the gravitational force? Is that going to like put your body at risk for bleeding, right? So if you look at the data from the organization that oversees amusement parks and roller coasters, they'll tell you that the risk of anything bad happening is so infinitesimally small, like 1 in 100 million or 1 in a billion. Why? How can they say that? You know how many people ride roller coasters every year. And if nothing bad happens, but once or twice, there's still a denominator of 1 billion people that have ridden the roller coaster, right? So some large number. So it always looks like it's the safest thing in the world. But you have to like really appreciate the stories of people or groups of people that have bleeding, especially inside their head, if they have a bleeding disorder. So we usually tell people with bleeding disorders of any kind, stay away from roller coasters that change the force of gravity, like the Graviton, the one that spins and plasters you up against the wall, right? That changes the force of gravity. The roller coasters or those drop lines that just drop you into a free fall. We say stay away from those. Okay, I'm going to wind down fairly quickly here. Other important questions we've been asked, like, what should I really expect from my clinic visits? How often should I be seen? Should I see an ITP expert? Usually our answer to that is always yes. What is my role, like you as the patient, in the management of ITP? So that brings us to that topic of comprehensive care. And that's what we specialize in here. We bring together all of the specialists with special training. And if you cumulatively look at it, it's hundreds of years of experience with all of our staff to make the best team to diagnose and help you treat your bleeding or clotting disorder. And then the other aspect is we take care of the whole person. Because we know that all those things that I've talked about affect your outcome and how satisfied you are, what kind of quality of life you have. We have this buzzword now that's going around, especially in the federal government, the Department of Health and Human Services, medical home, right? And that is all of these aspects that are on the slide here, but the first key to medical home for primary care people is to do comprehensive care. And we've been doing it for 4 decades. There's that same model for other diseases you've probably heard about, but for hemophilia and other inherited and acquired bleeding disorders, it's been going on for a long time. We have that well established for people with hemophilia and other inherited bleeding disorders. And here are just the definitions of that. Like I said, it's been the model of care for a long time. We've shown that it makes a difference. Like if we compare people that go to treatment centers that specialize, that are medical homes or that are comprehensive care centers, their outcomes are better, their healthcare costs are reduced, they're out of work and out of school less often. And very importantly, their chances of succumbing early to their bleeding disorder is substantially less. In one study, 40% less. That's the study that was done by the CDC back in the late 90s. Well, we have that established for hemophilia, but Kristen and I and Dr. Roberts and others here at BCDI thought that's the model of care we need for ITP as well. So we did this in what's called a white paper, a paper that sort of highlights the need for something. We did that for ITP, and we compared like how common the 2 bleeding disorders are and how it affects not only their medical health, but their quality of life. And we have lots of advocacy going on for hemophilia and other inherited bleeding disorders, but relatively little for ITP. So one of our missions here is to create that, extend that model to people with ITP. So I'm going to skip through that. We like to think of this, what's called a wheel and spoke model for comprehensive care. Like it's more than just medical and social services and having that expertise. It's research that helps better treatments. It's case management because there's all kinds of forces that get in the way of you getting good medical care. There's advocacy, like changing laws. I'll give you one example of that as I close it out. And there's education, because we believe the more you're educated, the more you help educate us, the better your outcome is going to be. So we launched the first comprehensive care center for ITP back in 2017 here. We've been doing the care that way for 10 years before that, but we formally did it in 2017. And it includes all those aspects that I mentioned. This is sort of and then now it's a little dated because we've got Rachel now instead of Amanda as our physical therapist, but this is like our core team. But Dr. Roberts, our other nurse coordinators, our other doctors, our other advanced practice providers are all part of this program. But we bring together all the experts, including Dr. Clemens on the right, who's an immunologist. So we want that expertise as well in that clinic. And it's been very successful. I mean, we're in our 7th year now and of doing it formally. And we do get referrals from most parts of the country. We have, based on a satisfaction survey, feel like everyone's enjoying that and appreciating that extra effort. We've taken an active role in the education part and advocacy. That link there, and I'm happy to share it with you after, is a link to the educational page for the Platelet Disorder Support Association. And we've helped edit or write a lot of the material that PDSA uses. And of course, we do ITP research as well, over 30 clinical studies, 60 published papers on the topic of ITP. So 2 little very brief examples of how we play a role. This PRN 1008 is an experimental medicine that, unlike prednisone as an immune suppressive drug, targets a very specific enzyme in your body that signals your immunity to make antibodies. And if we can turn that off to a certain degree, we can help raise the platelet count. So this, we participated in the phase 2 study of this drug, and it seems to be very successful. It's now in the phase 3 study phase and likely to be approved by the FDA probably next year. So BCDI took an active role in helping develop that drug. And then this, I think, is one of the many things that keep me going here. We've been on a mission to not just be the only center in the country to do comprehensive care for ITP. We want every center in the country to do comprehensive care for ITP. So we're on this mission to spread that word. So there's been a timeline. I started this sort of initiative even before 2010, but that's when we opened BCDI. We've been very involved in clinical research for many developments for good treatments. I'm sorry. And now, with the help of our partner, the Platelet Disorder Support Association, are leading a charge in Congress, actually, to get some appropriation, as in money, to pilot a network of centers that use our model of care to take care of their folks with ITP. It has bipartisan, and a word I learned not that long ago, bicameral support. So Republicans and Democrats are in favor of this. Everyone we talk to when we go to Washington to advocate for this is in favor of it. And not only the House of Representatives, but the Senate is also in favor of this, because we've talked to both houses. So we're very excited about that. We're on the cusp of getting the word out in a formal way to spread the word about this. So I'm going to skip through this, and I'm just going to close by saying, telling you or reminding you what our credo of sorts is. We start most things by doing what we have to do, what's necessary. Then we do what's possible, and soon you're doing the impossible. So thank you. I know I went a little over time. If there are no questions or comments right now, we can take a stand-up break for a minute, and then I'll try to think, we don't have time for that. I talked way too much. Right.